Did you know that suicide is the second leading cause of death in teenagers? It's devastating to think about. But if we hope to combat the rising number of cases, we have to have open conversations about teen suicide. One thing we can look at is the potential causes of teenage suicide. We know that the teen years are some of the most difficult for emotional development and learning to cope with all the various stressors. Teenagers dealing with mental health issues can be pushed deeper into depression when they are forced to experience these, like academic failure, relationships ending, or bullying. There are lots of factors that can contribute to having suicidal thoughts, and no two experiences are the same. The connector in all these cases is that people feel so hopeless that they don't see any solution to their problems other than ending their own lives. It's important to remember that these situations are very nuanced and complicated to navigate. And above all, remember that anyone showing signs of suicidal thoughts or depression is not doing it for attention, contrary to what some people might think. We have seen suicide rates rapidly increase over the past decade. Mental health issues in young people is a very serious issue. What are some factors that put young people at a higher risk of suicide? Issues can include mental illness, including depression, anxiety, PTSD, and bipolar disorder, substance abuse, a family history of suicide or violence, low self-esteem, having parents or caregivers with mental health disorders, dysfunctional home environments, peer rejection or lack of friendships, or emotional, physical, or sexual abuse. These underlying factors, when combined with a triggering event, can become deadly for teens and young adults. It's important to keep an eye on yourself and others who may have experience with one or more of these factors. Check in with the people around you who show signs of suicidal behavior or depression. Just reaching out could help save a life. In most cases of suicide, people who knew the victim are left wishing they would have done something. But how can we step in if we don't know the warning signs to look for? That's what we are going to talk about right now. Some warning signs to watch for include expressing suicidal thoughts, feeling of hopelessness or guilt and shame, experiencing severe depression and emotional pain, high anxiety, chronic physical pain, drastic changes in academic performance, and risky behaviors such as self-harm or reckless driving. If you see someone showing these signs, it's important to get help. Talk to a trusted adult and make sure the person knows that they are not alone. Knowing the warning signs is a crucial part of suicide prevention. Did you know that teens in the LGBTQ+ community are 2 to 7 times more likely to commit suicide than their straight peers? Many LGBTQ+ teens struggle with the negative stigma surrounding them and a lack of acceptance by friends and family, which can ultimately lead to suicidal thoughts. A crucial part of lowering these rates and protecting our LGBTQ+ community is creating safe spaces where people feel they are accepted and loved as their true selves. To show support, consider distancing yourself from people in your life that are homophobic or do not support the community. Make sure to show support to everyone around you, as you never know who may be struggling. And above all, never make fun of or use someone's sexuality and gender identity against them. If we can all be more loving and accepting of people, we will make the world a better place for everyone. If you think that racial issues are a thing of a past, think again. Unfortunately, racial minorities face more discrimination than white people, and these leads to increased rates of suicide in these populations. A study done in 2018 found that suicide was the second leading cause of death in Black children ages 10 to 14, and the third leading cause of death in Black adolescents ages 15 to 19. Issues such as racism and discrimination, higher rates of unemployment, financial and food insecurity, and less access to mental health services all contribute to these statistics. Young Black lives matter. So what can we do? Increased access to mental health services, improved economic disparities, and targeted efforts to enhance the lives of Black teens can help to prevent these suicide rates. On a personal level, increased support and acknowledgement of the struggles Black people face can help bring awareness to these issues. Knowing the early warning signs and risk factors of suicidal behavior can help prevent teen suicide. If you or someone you know is struggling with suicidal thoughts, visit sandstonecare.com or call the number in the description box below. We will get to know you and your situation and connect you with the support you need, even if it's not with us. Change is possible, and Sandstone Care is here to help.